Today we're here. I want to thank everyone that has worked so hard to craft the legislation that we're unveiling today, especially the Colorado District Attorney's Council, the Public Defender's Office, as well as the bipartisan co-prime sponsors. To Representative Lynch, to Senator Cook, to Senator Pedersen, thank you so much for all of your work. I've been working hand in hand with Colorado's district attorneys to craft a comprehensive solution that attacks fentanyl from all sides and gives law enforcement the tools they need to crack down on this deadly poison. This bill will include proven public health strategies to address the root causes of this crisis, as well as increased penalties to get those who are peddling this poison off of the streets. Fentanyl overdoses and fentanyl poisonings are killing far too many Coloradans and devastating our communities. Fentanyl is unlike any drug we've seen before, and we need to treat it differently. The way that people are losing their lives from this drug is different from other overdose deaths, because in many cases the victims don't even know that they've taken the drug. It's being laced in all kinds of other drugs with deadly, deadly effects. This legislation aims to save Coloradans' lives. The dealers peddling death in our communities will be held accountable. This bill gives law enforcement and the prosecutors the tools they need to put dangerous fentanyl dealers behind bars. Low-level dealers, mid-level dealers, and high-level dealers. All are contributing to this crisis that we're seeing throughout our communities. They will face stiff consequences. Let me be clear. Distribution that leads to death will be a level 1 drug felony. When a dealer kills someone with what they've sold, that dealer is going to face very serious charges. Drug dealers will have to know what they are selling and will be held accountable when that fentanyl-laced drug leads to someone's death. If law enforcement finds a pill press, the device used to manufacture compound fentanyl pills, that dealer will face a level 1 drug felony. We also significantly are increasing the penalties for people caught importing the drug to Colorado. We are going to go after the distribution networks, the dealers, and the people bringing these laced drugs into our state while not criminalizing people who are struggling with substance abuse. Our plan will help cut off the supply and eliminate the demand by getting people the help that they need. This bill includes millions of dollars for proven and effective public health strategies that will help keep people alive and give them the tools they need to protect themselves. In this bill, we are using federal ARPA dollars to help boost the supply of life-saving Narcan and boost treatment solutions for people struggling with substance use disorders. Through this comprehensive solution, we know that we will have the resources to help on the public health side, while at the same time relying on other bills that are making their way through this legislative session to build out the workforce and the access to our behavioral health network that will help address the root cause of addiction. Colorado will be safer if this bill is signed into law. It's an honor to stand before you. We have a lot of work to do to make sure that this bill gets across the finish line. But I want to thank everyone who's standing behind me. I want to thank everybody who's had a hand in crafting this legislation. And with that, it's my honor to hand it off to Governor Polis, the governor of the great state of Colorado. Thank you very much.
Thank you, Mr. Speaker. Thank you, Mr. Speaker. Good morning, everyone, and thank you for joining us. Really, I'm proud to stand here with a very broad coalition, people from across the state, law enforcement, accountable under the law rather than have to follow a trail of bodies when it's too late. I want to thank all of those in attendance. You'll hear from many of them here today, and I want to thank them for joining us. I'm also proud to be joined by our own Lieutenant Governor, Diane Primavera, also the head of the Office of Saving People Money on Health Care. Fentanyl is something that affects everyone in every community across our state. Quite simply, far too many families have experienced loss and tragedy from the impact of fentanyl. It ruins lives. It causes deaths. And what this effort is about is recognizing in law that it is different and should be treated differently under the law than other illicit substances. And that's completely appropriate, because as you try to form the right public policy response for a particular drug, you look at what that drug does. And one thing we know about fentanyl is fentanyl kills. I know that we're all sick and tired of hearing the news of yet another life that's lost because of fentanyl. It's why in my State of the State I called for stronger criminal penalties, and why today's rollout is so important. After thoughtful collaboration and months of conversations with law enforcement, with prosecutors, with public health experts, with community leaders, led by Speaker Garnett and other legislators, this legislation truly begins to address the scourge of fentanyl in our communities, and its legacy will be saving lives and holding criminals accountable. This bill will help get distributors off the street. It'll provide law enforcement the resources to address fentanyl, and it also makes sure that it provides a path for help for those who are addicted. Another key component of this legislation is public education and awareness around preventing overdoses and giving Coloradans better tools to stay safe. We all wish that there was a silver bullet, and we see a wide variety of states with a wide variety of policies, and there's tragic loss in every one. However, I am confident that this thoughtful policy, with the input of law enforcement, prosecutors, community activists from across the state, will help reduce the death toll from fentanyl in Colorado and gives us better strategies to really attack this issue in a strong way from every single angle. I look forward to this legislation moving through the process and look forward to celebrating a day where we know that we can make Colorado that much safer. With that, I'll turn it over to former Sheriff and Senator John Cook.
Good morning. Thank you for all being here, and thank you to the families and other dignitaries here. Thank you. My name is Senator John Cook. I represent Senate District 13, and I'm from Greeley. And I'm proud to be sponsoring this legislation with Speaker Garnett, Representative Lynch, and Senator Patterson. Every community in Colorado is combating the fentanyl crisis, and they need our help. This deadly drug is unlike anything we've seen before, and that means we need new tools to address it. This legislation is comprehensive. Sheriffs and law enforcement need new tools to hold dealers accountable for distributing deadly fentanyl, and we're going to give it to them. We're going to give them what they need. This bill treats fentanyl like the dangerous drug that it is and significantly strengthens the criminal penalties for dealing it. Going after the dealers will crack down on fentanyl and prevent more people from dying. As a former sheriff, I know our jails are not just part of the criminal justice system, but now are part of the behavioral health system as well. This bill boosts funding to help our jails get people clean, so when they complete their sentence and return to the community, they can sustain a successful recovery and reduce their chances of being arrested again. It also provides our jails with bulk pricing discounts for life-saving Narcan, so they can act quickly to prevent overdoses and poisoning and give people tools to protect themselves when they leave jail. By lowering the cutoff points for charging for intent to distribute, we are providing a significant tool to law enforcement to break up crime rings and hold dealers at every level accountable for the deaths that they are spreading in our communities. The cutoff points are coming way down, which is critical if we are going to go ahead and go after the people responsible for deaths we're seeing in our state. You might ask, Why is this bill needed? I think we all know, but there is a rising spike in fentanyl deaths in our community. It's shocking and not surprising, though. In 2015, 5 Coloradoans died as a result of fentanyl. In 2021, close to 900, 875 to be exact, died of fentanyl. In just 1 year, from April 2020 to April 21, fentanyl overdoses and poisoning increased by 24%, an unprecedented spike. It is abundantly clear we must take action to address this crisis, and this legislation is a critical step in that. This bill aims to thwart the accessibility of fentanyl-laced drugs on our streets by severely punishing those who peddle fentanyl into our communities and providing resources for first responders and community organizers and organizations that are working to mitigate the devastating effect of this drug. When passed, anyone who imports fentanyl, distributes fentanyl, laced drugs with fentanyl, possesses a pill press, or possesses fentanyl with the intent to distribute will be charged with a felony. If we want to stop this drug from ravaging our streets and killing people, we must be tough on the criminals who are peddling it into our communities and make it abundantly clear we will no longer tolerate the free flow of fentanyl to our streets. This bill will also issue a misdemeanor and require a mandatory addiction evaluation for anyone caught with under 4 grams. This legislation will also aim to reduce overdose deaths and poisoning, providing vital public education and providing opioid antagonists and test kits to the public. We will work not as Republicans or Democrats, but as concerned Coloradoans who want to bring an end to this ongoing crisis that is doing harm to our communities across our state. Thank you, and I'd like to introduce Senator Patterson from Jefferson County.
Hi, everybody. Thank you for being here today to cover this incredibly important issue. You know that we are facing the worst overdose crisis in our history. That is partly because we have a broken behavioral health care system that so many that are with us today have dedicated years and millions of dollars in fixing. And we are also seeing a significant increase in fentanyl deaths. In fact, from 2015 until now, we've had a 1,008% increase of fentanyl deaths. So I'm proud to stand today as a sponsor in the Senate for this bill. You all know my story. I come at this from a perspective of empathy because of my mom. She became addicted to opioids when I was very young, which ultimately led to a heroin addiction. In 2017, my mom started overdosing at a very high rate. And that's when everything changed and she was begging for help. In 1 year, she went to the ER 20 times for an overdose. And the last time that she visited the hospital, she overdosed 3 times in 1 day. That was partly because of the spiral of the addiction that she was in, but it was mostly because that's when we really started to see fentanyl enter the drug supply chain here in Colorado. I had the opportunity to visit Canada with Representative Harrod, and we met with the local public health agencies, with law enforcement, to learn about what they're doing in Canada to address their overdose crisis. And the law enforcement agencies and the folks that we met with warned us about what was going to be happening and what they have seen firsthand in Canada, which was there was no longer heroin. They were able to mitigate some of the deaths with some of their harm reduction strategies and increasing access to treatment, but they were starting that because of drug cartels and their smuggling of fentanyl into Canada, there was no longer heroin on the street, and they had a huge increase in overdose deaths. They said, this is coming to the United States, this is coming to the rest of the world, and they warned us of what the future here was going to look like. And here we are today. So what I really appreciate about this bill is that it is not a knee-jerk reaction to trying to criminalize people who are addicted and have possession of drugs. This is coming at it with an approach of empathy, with increasing treatment to medication-assisted treatment, to substance use disorder treatment, making sure that we have test strips available, but also it comes with an approach of accountability for those who knowingly are distributing fentanyl and are poisoning people across Colorado. When I think about the world that my son will grow up in, he's 2 years old right now. And behind me are many parents here holding pictures, and sisters and brothers and loved ones who are holding pictures of the people that they have lost who were poisoned. They didn't know that they were taking fentanyl. They thought they were taking a Xanax, maybe bought cocaine, and maybe they made some decisions that we all hope they wouldn't, but they didn't think that they were going to buy fentanyl, and they were poisoned. We saw the story in Adams County of the group of people who were doing cocaine, and numerous people died that night. So what I appreciate about this bill is it gives law enforcement the tools to investigate and hold those individuals accountable, but it also approaches this with empathy and understanding. The other pieces that I want to point out is that this bill is not, as the governor pointed out, this is not all that we are going to do here in Colorado to address this issue. It's not just addiction. Like we said, this is people being poisoned, and we have a public awareness campaign around this. This is a critical piece. Thinking about my son growing up in Colorado, in the United States, where you think that you make a decision to buy a pill, you think that you might make that bad decision, but you don't know that you're buying fentanyl. And so it's really important that this piece is not just the other comprehensive pieces that I've talked about, but also a public awareness campaign so that individuals across Colorado know what's at stake. When you listen to law enforcement, and you'll hear a lot of stories today, they say that there is not a drug out there now that doesn't have fentanyl. That is cocaine, that is marijuana, that is heroin. And so we really need to do our part, and I'm proud of this bill for actually trying to bring attention to what the dangers out there just from taking one pill, that you unfortunately could lose your life. So I really want to thank everybody for coming together on this with the comprehensive approach that is taking, as well as the other behavioral health care reform bills that we're working on. With that, I will pass it on to DA Sides.
Good morning. My name is Travis Sides. I'm the district attorney for the 13th Judicial District. Our office represents the 7 counties in Northeast Colorado. In the past few years, all of our communities, metro and rural, large and small, have felt the deadly impacts of fentanyl, and things are only getting worse by the day. Young people think they're getting oxycodone, but they're getting a pill laced with poison. This legislation is a much-needed step in the right direction. By increasing penalties for those who take human lives by selling fentanyl-laced drugs. While there's still a lot to be done and room for more, I'm very thankful to Speaker Garnett and the Colorado Legislature that they're taking up this important issue. We must protect our communities from those who would cause them harm. Thank you. I'll now turn things over to Representative Lynch.
Thank you for being here this morning. I'm Representative Lynch, House District 49, the rural parts of northern parts of the state. But the real reason we're here is because of these families that are here. We're here because in this state, we are losing innocent lives we went through a pandemic, now we have an epidemic. And what we're dealing with is something that we've never dealt with before. This is the next step that we're seeing occur in drug use. And so that's why this bill that I'm very honored to be on takes an innovative approach to fix the problem quickly, fix it now, and address this horrific issue. You've heard all the specifics of the bill. I'm just excited. This is not a partisan issue. This is a leadership issue. This is where we come together as a state to find and fix problems, and I'm honored to be a part of it. I will now turn it over to Eret Gallegos.
Hi, my name is Loretta Gallegos. Thank you. On April 14th, (2021). Sorry. That's the day our lives changed forever. That is the day that we lost our beautiful Brianna to fentanyl poisoning. She was a loving daughter, wife, and mother, a caring sister, a friend. Brianna did not want to die. And would never have wanted to leave her son, Aaron, who she loved more than life itself. Aaron and April, her dog, were her everything. Brianna's life hadn't been an easy one. She was sexually assaulted by someone she trusted, and that trauma stayed with her for a long time, eventually leading her down a darker path. Like so many who have suffered abuse, Brianna looked for ways to numb her pain, and she turned to alcohol and Percocet. She knew she needed help, and we had been talking a lot about finally seeking therapy and treatment to deal not only with substance abuse issues, but with the traumas that were lying at the root of it. The day before she died, we were so excited because she had finally been able to make an appointment to seek help, but the appointment would be too late.